I'm Amanda Pierce-Kelly. I'm the CEO of Advocates for Community Health, ACH. And ACH is a coalition of like-minded community health centers who came together with a collective vision for a healthcare system that's based in access and health equity for all of America's underserved communities and really for all of America as a whole. The founders came together with a vision for the future for community health centers, with a lot of excitement and passion around health equity and access, and really thinking about how health centers can carry the healthcare system into the future and be really the foundation of that healthcare system. And again, carrying health equity through all of it to make sure that our underserved communities are represented, taken care of, well cared for, but also that our nation as a whole can do better, putting health equity at the center of that. Well, in just under a year, ACH has not just come together, but we've brought together 14 founding organizations. We're nearing 20 members to our ranks, and we're still growing. We're really excited about the work that's already begun. Our initial focus being on the infrastructure bill and the investment in community health centers, supporting a $10 billion request for investment in the community health center program at a minimum. The reality is that the needs of community health centers in the infrastructure space is actually quite a bit larger than that, but we definitely want to make sure that Congress at least invests that $10 billion into the infrastructure piece. We've also been focused on the Emergency Preparedness Fund. It's a $275 million emergency preparedness fund. It's available to all health centers, not just larger organizations, and it's really taking into account the lessons learned coming out of the COVID-19 pandemic and the role that health centers played in leading and coordinating the response in their communities, working in collaboration with the health departments and other stakeholders to make sure that our patients and our communities had access to testing, vaccination, and frankly, all of the other services and resources that they needed to get through the pandemic, and that continues today. The Emergency Preparedness Fund is really thinking forward. How do we put in place the resources, the staff, and the programming to ensure that in the next emergency, whether it's pandemic or climate-oriented, other natural disasters, that health centers are really well prepared, have the resources, the staffing, and the support to make sure that they can continue to play in that leading and coordinating capacity. So ACH serves more than 1.3 million patients, and we care for a variety of Americans in underserved communities. So that includes Medicare and Medicaid beneficiaries, the uninsured, veterans, students, those experiencing homelessness, agricultural workers. It's really anyone and everyone who needs good access to care. Health centers, of course, are there to serve underserved communities, but in fact, we provide the highest quality care in a primary care setting across the nation. Well, we realize that these issues are complex and they're long-term. The work is going to be ongoing, but we're really excited to be bringing on new members at a great pace. We're excited to have like-minded partners and strategic collaborators joining us in this effort. We're excited about working together to advance this vision for health equity in America. And so as we continue this work, we're really excited to share more information, to provide the updates on that ongoing work, but also to really engage our members, our stakeholders, and those advocates who want to join us in this effort to advance health equity across America. The best way to get more information about ACH is to visit our website. It's advocatesforcommunityhealth.org. You can also get more information on LinkedIn. We'll be posting updates there. And then you can always be in touch with me and the rest of the team directly. info@advocatesforcommunityhealth.org is the best email to access us. We're just really excited to be in touch with everyone who wants to join us in this incredible endeavor to advance the health center program, to advance health equity, and really drive a forward-thinking, visionary agenda into the future that will see health centers at the center of all of it.